Hello everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center. And today I wanted to talk to you about all the different options and procedures that we do to help rejuvenate your eyes. So as we start aging, the eyes are one of the first areas that really show our age. The skin is our thinnest when compared to other body areas, and so it tends to show sagging a little bit faster. We also notice that sometimes allergies can aggravate the eye area and cause the skin to become more irritated and looser over time. We also notice pigment changes that occur in this area, vascular congestion, and then of course the bulging of the fat pockets, and then also a relative hollowing of the under eye area. So there are a lot of different procedures that we offer that help. One of them that's very easy to perform is something called botox, which we can help to relax the crow's feet. Those are the lines formed from excessive squinting of the eye area. It does not affect one's smile, because I know patients often are concerned about, but it does help to eliminate the crow's feet that happen with age. And then we can also add fillers in the under eye area if it begins to look a bit hollow. And that's usually one of the first procedures that we will perform along with Botox in somebody who is of a younger age. If the hollowing is getting a little excessive with bulging of fat pockets, then we have to address the fat pockets themselves. If they're not too extreme, we can use some procedures like Thermage, Ultherapy, and also Thermismooth, Exilis Ultra, to help tighten the skin itself and also help to gently melt some of the fat in that area. So those are some non-invasive, completely no downtime procedures. Some of them are a single treatment such as Ultherapy or Thermage, and with others we recommend a series of treatments such as with Thermismooth or with Exilis Ultra. And then we also have fractional technologies that include lasers like Fraxel laser itself, fractional radio frequencies such as Venus Viva, or now the new Morpheus 8 Prime, which is a really cute little tip that has small needles that go through the skin and deliver a precise amount of energy under the skin. We can also do straight microneedling, often in combination with PRP especially. It's really excellent. And then we have the more aggressive resurfacing lasers, which we can use both in a fractional mode, such as doing a Madonna lift with a fractional CO2 type of approach, or a fractional erbium, depending on the severity of the laxity. And then we can also do that in continuous mode and just take off an entire layer of skin and get an extremely dramatic effect on tightening, depending upon how much recovery time one is willing to give us and how many treatments one would like to accomplish the job, and what the tolerance is, and as well as how much laxity there is to begin with and how much work needs to be done. So another new technology that we have in our office now is called Accutite, which is part of the BodyTite platform. And it's a small probe that injects RF energy precisely under the skin at a set temperature. There's a little plate on top of the probe that sits on the skin and measures the external skin temperature. So in that way, there's precise control of temperature from the deep tissue to the superficial, and that keeps it at an ideal range to help with tightening the skin and also melting away the fat in the area. So that's a great way to get a non-surgical lower eyelid surgery, essentially, but without any cutting, literally just through a needle puncture, so no stitches even. And then I also do actual eyelid surgery where I can remove the excess skin and fat from both the upper eyelid and the lower eyelid. In the upper eyelid, it takes about a week to heal, and there are little stitches. They're right in the crease, so hardly even visible once it's all healed, but makes a really dramatic improvement. And in the lower eyelid, if I feel that that might be the better way to treat the area, I can also go ahead and remove those fat pockets surgically with a little incision that is made on the inside part of the eye, and that incision is not visible and also does not require stitches. So those are all the different modalities we have for eyelid rejuvenation. I do want to mention also patients often present with brown pigmentation or veins that are really prominent around the eyes, and I can remove that with laser for both vessels and for pigmentation. So please do let us know if you have any questions at all. We really like to stay on top of all the latest technologies and procedures that we can offer our patients and do it safely and continue learning and educating ourselves and you. And please do subscribe to our YouTube channel, and I hope you enjoyed watching this. Thank you so much.